The client meets the criteria for ASAM Level 3 due to the needs of attentive structure, continuous support, and separation from high-risk environments to maintain safety and sobriety. Without Level 3.5 services, the client is at imminent risk of relapse and serious harm. Client is not showing or experiencing any DTs or withdrawal symptoms from alcohol and his cannabis use. Client does not have any chronic medical needs that require monitoring or dietary restrictions and is not prescribed any medication for physical problems. The client does not remember the date of his last physical examination. The client does not remember the date of his last dental appointment. The client has no physical health goals. The client does not need any referrals for now. Client appeared with poor hygiene and lack of motivation or interest in SUD treatment. Dimension 3. Client's mental health diagnosis is severe depression disorder and severe anxiety disorder. Client struggles with feelings such as sadness, worrying a lot, and lack of interest to do normal healthy activities. Client is prescribed medication for his psychological problems such as Buspar. Client's mental health goals are to obtain psychological and emotional coping skills. Client needs referrals for a psychiatric doctor. The client has a history of treatment through a psychiatric hospital. The client has no plans to harm himself or others. The client's motivation to change is his mother. This is Dimension 4. Client is willing to try a residential treatment program but fears he will not complete the program due to his cravings, thoughts, and emotions. The client is tired of feeling hopeless and drinking alcohol. Dimension 5. Client is using substances such as alcohol and cannabis. Client has been using this for over 15 years. The client's triggers are his thoughts, emotions, and environment. Client's coping skills are to drink alcohol and smoke cannabis. The client can't stay sober because of his unstable environment and his lack of coping skills for his thoughts. Client tried getting sober before by attending AA groups. Dimension 6. The client has been homeless and living with his parents on and off for over 20 years. The client has just been released from prison. The client is currently unemployed. Client is not currently enrolled into school. The client income comes from public assistance, welfare. The client is on parole. Client's supportive relationships are his mother.